Director of College Access for Fulfillment Fund. And here with our mental health experts panel, we have three amazing panelists. I'll go ahead and introduce them and let them talk a little bit about themselves. First, we have Dr. Laura Dickerman. She is a mental health service provider, community mental health. She's currently working as a mental health clinician at a public university. She has accumulated experience and skill in mental health in settings such as hospitals, residential settings for children, community services, and the Los Angeles County Public Mental Health. Also with us tonight is Dr. Rafael Romero, mental health consultant. Dr. Romero is a board certified clinical psychologist with specialties in trauma, family psychology, infant mental health, training and consulting, and he's recently started his own business with integrative therapy. And also with us, we have Kim Zach. Kim Zach is a Healthy Steps specialist from Children's Hospital and Clinics in Minnesota. She works as a mental health professional in integrative behavioral health at a general pediatric clinic. Her current role as Healthy Steps specialist focus on infant and childhood mental health. And so thank you again, panelists, for being here. But with that said, I'd like to just kind of start off with everybody, and we'll just to kind of do a round robin lightning round, just a little bit more about yourself, a little bit about how you got into this field, and we'll go from there. So Laura, do you mind starting us off?
Of course, my pleasure, and welcome to everybody. So my name is Laura. I am actually a Fulfillment Fund scholar. I graduated high school in Los Angeles 2005, actually. And from there, Fulfillment Fund has been very helpful and grateful for everything that they've done. I got into mental health, specifically social work. I went to Cal State Northridge for my bachelor's and was able to go to USC for both my master's of social work and my doctorate of social work. And from there, actually, Fulfillment Fund was actually a very great asset to me in navigating how to reach out to certain mentors and certain individuals to talk to about what realm of mental health I wanted to go to. And as other panelists will discuss, there's so many different realms of where we can go with the mental health portion and exactly what I wanted to do. So I was able to reach out to some counselors, talk to some individuals that became my mentors that kind of helped me navigate what route I wanted to go to, if I wanted to be a marriage and family therapist, if I wanted to do advocacy work, policy work. And I was actually first started off with children's, and that's where I navigated. So children's in residential settings. So these were kids who were in requiring of higher level of care. And from there, I became more passionate about the adult mental health and the jail, basically, primarily. And I was actually reaching out to someone that I knew within the Los Angeles County. And I would suggest, and if, you know, I always tell people, just contact random people. That's always what I say, contact random people, because, you know, you never know what that will lead you to. So I actually reached out to someone in the Los Angeles County departments who kind of led me to someone else within the Department of Mental Health and the Department of Health Services in actually volunteering for them at first within the jail. And from there, I actually got a job as a program manager navigating the jail system. And from there, that's where I kind of stuck in a good way. And I currently, after 10 years of working as a mental health specialist, I actually now work with one of the universities here in New Jersey. And actually through them, we're contracted to go into the prison system to provide mental health and assessments for the inmates that we service here in the state of New Jersey. So I always tell people, find a mentor, bug people. The worst you can get is a no, but the good things that you would get would be someone leading you to someone who would open doors. I hope that answered your question.
Yes, it did. Thank you, Laura. Kim, how about you? You tell us a little bit about your pathway to the position that you are now.
Definitely. So, my name is Kim Zach. I'm a licensed professional clinical counselor, which is a master's level therapist, and I'm based out of Minnesota. So, the different licensure tracks that you can take vary by state, but this is a master's level professional counselor. Um, I got into the field, I think, when I think about it, sometime in high school. I read a book where a person was doing group therapy with a group of traumatized children. And I kind of locked that away in my head as something that seemed kind of interesting. But I didn't really know what I was doing to get there. And I went through my undergrad. I did a degree in biology and I did a second master or a second degree in psychology, and left my undergrad feeling like, oh my gosh, I really don't know what it is that I want to do with these two things. I'm fascinated by neuroscience, fascinated by, how the brain works and how it comes out in behavior. And took a little bit of time off after I finished my undergrad and then realized that, counseling and social work were kind of the direction that I really had been considering this whole time. So I looked into programs that were nearby, and was able to find a master's in clinical counseling program that really kind of matched what I was trying to do in the timeline that I was trying to do it. Did that, and I worked for a little while with my master's in day treatment for children between the ages of 5 and 10, and in day treatment for children diagnosed with autism between the ages of 3 and 6. Found myself really enjoying that. And what I really loved about day treatment, particular to the programs that I worked in, was the integrative nature of them. The programs that I worked in worked side by side with a mental health therapist, an occupational therapist, and then in the autism day treatment, also a speech therapist. So that multidisciplinary approach to therapy really stuck out to me because it was helping kids in a variety of different ways to really figure out how to help them regulate, how to help them build healthy relationships and communication skills. So from there, I found with the integrated model of care that it led me to school-based mental health services. So I worked as a program director or manager for school-based mental health services, which put therapists into school buildings so that kids can get the services that they need right there in the school building. They can leave their classroom to attend a therapy session and then go back to class. So their family doesn't have to do a lot of the transporting. They don't have to miss more school to get to therapy during the day. And they're more likely to attend their sessions. So their symptoms tend to improve because we're integrating with teachers and things like that as well. So while I was doing that, though, I realized that I missed working with the young children that I'd worked with in my autism day treatment program. So I went back to school for a 2-year certificate in infant and early childhood mental health at the University of Minnesota. And then was able to kind of post-pandemic find my job that I'm doing right now, working in a pediatric clinic in a program called Healthy Steps, which integrates behavioral health into early childhood. So I work alongside pediatricians and nurse practitioners to identify children and their families under the age of 5 who could really benefit from some work with the relationship between parent and child. And so that's what I'm doing right now, and I really love it. But that's kind of the way I got to where I am right now and found the job that really means a lot to me at this point in time.
Thank you for sharing that, Kim. That was amazing. Rafael, how about you tell us a little bit about your story?
Yeah, so actually, when I joined the fund, I actually was in had the desire to become a psychiatrist, and that essentially was the road that I wanted to take. And the fund was very helpful because it exposed me to a lot of things. Dr. Gignick was a doctor, so it was easy with him to make connections. When I got to college, I majored in pre-med and theology. I double majored. And then about 3 years into finishing the degree, I just realized I didn't really want to become a medical doctor. So many of us don't have the conception. They always say shrink. And if there's any psychiatrists listening out there, I don't mean any offense, but in the real psychology or mental health world, they're more medical and medical and medicine management, where I wanted to work with people and what goes on. So I actually changed I finished my degree and I decided not to go to medical school. And I went to seminary. So I went to college in Arkansas, then to seminary in Dallas, because I wasn't ready to come back to California. Just felt like it would have been too much of a shock going from culture to culture. But it was really good to leave Los Angeles and see another culture. I really do encourage that. If you can, at that time, we weren't that well connected to fun. But I really do encourage you, if if you're another state or you're able to go and visit other states and go to school to those states. I was able to finish my degree and I did a cross-cultural internship in Spain, because my goal was to come back and work with families in the Latino community and also the inner city. So that was really eye-opening, to be in Spain doing an internship and realize I didn't speak Spanish as they would like me to. All of these become shockers to you as you go around the world. But I was able to later get into a doctorate program in California at Biola, which helped me to return back. So I applied for both the PsyD, Doctorate of Psychology, and the Doctorate of Philosophy, sorry. But again, in talking with them, the Doctorate of Philosophy was much more research oriented, where I was more wanting to do clinical work. And so I went with the Doctorate of Psychology. And it was great because from then I was immediately able to work in the city. I think my first placement was in Whittier, now called, I believe, the Whole Child. So I started there working with children. And then I moved from there, I moved to contract. It was contracted LA County. And then I did my internship with LA County Department of Mental Health. And from there, I was able to work. I actually had 3 placements. I was working in the women's reintegration. I was working Twin Towers Correctional Facility. And I was working Augustus Hawkins, which no longer is. I think it's now the Tom Ridley Behavioral. It just opened up last year, which was great because it was really everywhere where I had been in Los Angeles, having grown up in Los Angeles. So it really gave me a really good exposure. After I finished my internship, they offered me any one of the positions, and I took Twin Towers Correctional Facility because I wanted to work severity in correctional mental health. From there, I worked with juvenile mental health in the juvenile system. And then I had kids and I realized I don't know what I'm doing. So kind of my trajectory of life has been, as my life goes, I become trained. So then I went out of the juvenile system and then went to infant mental health with ties in Torrance. And I'm only saying to you the cities because I kind of jumped around. I think it was downtown LA, Commerce, Whittier, Torrance. So I finished the infant mental health specialty there because I already had done trauma and training. All this time I've been training people. And then I landed back to specialized foster care, which was my last placement with LA County Department of Mental Health. And that is a really good place, by the way. Whatever you hear about LA County Department of Mental Health, I know it has a lot of things, but it is a big, I call it a big mental health university. Once you're there, you have so much ability to go, as you can see how many places I trained in. Still a big fan of it, and there I work with children in foster care. And what made that last post really great is I really worked the whole city. I'd go to the homes, I'd go to my neighborhood where I grew up. I'm like, yeah, I remember what happened there. Yeah, I remember what, it was so interesting just to be working in my own neighborhood. And I also, during that time, worked crisis, which is the person who hospitalized adults and children. And so it really gave me a lot of, I really got what I wanted, which was to work with people, work in my community. And only till last year that I left to South Carolina, honestly, because I like the warm beach, and I really moved for those reasons. And it was just a good time. I think I'd done about 20 years in the field, and I thought it's ready for me to try something else. and it's been great. I still have clients both in California here. I'm licensed in both states and consult most nationally, and around the world. So you know, I mean, I can't say more than if you're going into this field, at some point, tap into LA County Department of Mental Health. It is the largest mental health provider in the world. Twin Towers Correctional Facility is the largest inpatient treatment facility in the world. So that's how close you are in LA to learning about mental health and being trained in practice. Anyway, so glad to be here and glad always to help the fund any way I can.
Thank you, Rafael. For tonight, our theme is standing out and standing together. And it's that piece that I want to kind of highlight next, and that, we want our scholars to understand that they don't have to do this alone. And I want you guys to talk a little bit about your experience with any mentors, right? If you had a mentor, how did you get them? And how did they help you?
I can start. So as I mentioned, so I had gotten an internship / job right at my last year of my my undergrad. So I was actually at the Child and Family Guidance Center in Northridge. And from there, I was very curious about one of the licensed clinical social workers, one of the LCSWs there, that she had multiple hats. She was a therapist, she was a supervisor, and she was also a liaison, like a field liaison for one of the colleges. And I just was fascinated with, how does this person do all this? And I went up to her. I her name, Tiffany Brooks. I always throw her name out there. She took me under her wing immediately because I was really curious about, what were the steps. And she openly told me about the different items in mental health. She led me to, again, curious about MFT, curious about psychology, every aspect of social work. And from there, I actually got passionate about going into USC, into getting my master's. And so that led me to that for a couple of years. And I still talk to her even to this day. It's been like 12, 13 years since, I've had her. So she helped me navigate that portion. And as I mentioned earlier, I was bugging someone in the like Rafael said, I was bugging someone in Los Angeles County about my passion at that point of, jail mental health. And even though he couldn't help me, he helped me move towards a medical director who was working in the Department of Health Services, that's how she let me volunteer, in the courts. And eventually I was able to get a position, as one of the program managers there, and actually field a lot of my passion of like, whoa, this is where I want to be at. So, I think it's just, navigating, asking, even if someone might not have the answers, still seek it out. And like I said, this person wasn't able to help me out, but was able to give me good resources of maybe someone who would have the answers, or maybe would be willing to take me on to kind of develop those skills as, as an incoming clinician, social worker, mental health provider. So, it's a scary notion, but, I think it's that eagerness of everybody being together to help out those who we're trying to ultimately help out in our own, and help out those individuals in our community.
Yeah, I mean, I'll go next. Gosh, it's when you think of mentors, I think I really want to come back to the fulfillment fund notion, and I think Laura's touching on this, and I still remember Dr. Gitnick and Sherry. I mean, they're all gone now. I get it; it's a whole new group. But just saying what Laura's really saying, going out there and asking. I never had exposed. They actually exposed me to my first mentor. Two of my first mentors came from the fund, and it was a really great experience. I mean, it wasn't in my field. He was in Capitol Records, but the other mentor was Todd. But really, what I got more from them is not that we will provide you mentors, but to go and seek them, and I did. I mean, I visited after not deciding not to go to medical school. I went to visit the seminary that I wanted, and I asked for a certain person there, who was, the psychologist there, the language professor there. And then when that, that came about, and then I started looking at the other schools, and I would email the schools of the professors that are there. Hey, I see that you're doing this. Can you tell me what are you doing in considering a doctorate program? And they would respond back. And some didn't, but I think for the most part, they respond back. Yeah, you ought to try this, you ought to try that. And that initiative came a lot from the fund saying, go ahead. And even my jobs that I switched, when I wanted to switch a job, I'd email someone that was working there and say, hey, how are you guys doing? What's going on? Is there a possibility for me to go over there? And then, of course, when I joined LA County Department of Mental Health, I got mentored even more as to where I wanted to go. And I was at 3 different sites, but I think the idea was always to seek where you want to go. And if you were willing to do the work, most by and far, I think that's the reason I got into training and mentoring. And even to this day, people will email me and I'll write them back. No, go this way. That makes sense. Because I felt like so many people really guided me on avoiding the pitfalls, the difficult things. And they're like, yeah, that may be a hard spot for you, but this is what you want to see if you want to do. So it hasn't been one mentor. It has been a plethora of people that have really, out of the kindness and just wanting to help other people, that I've been guided, and it's been a very fortunate piece because I've had a lot of good placements, good jobs. I told a recent contractor, I said, I've been privileged that I've always have chosen where I wanted to work. And I realized after I said it that isn't for everyone, right? And I thought it's because you seek them out, and I think people are wanting people that are wanting to come and learn from them and be with them, and I've always, of course, loved learning. I think that's why I stayed in school so long. But it is about seeking people of things that you're interested in, and again, to this day, if you have my email, I'm on linked. People write me from around the world. Hey, I want to come to this. I'll write them back. I'll say, look, this is the process for me. This is how it is. Because I feel like that's a way to pay forward with a lot of people that I actually never really met. We all communicated. Back then it was email. It wasn't, it was just email and gosh, but it really came from the fund's notion that you should go out and seek, just so you can get an idea of mentoring. I've always, at the last fundraiser, and I tell this to people, it's so surprising, one of my biggest people that I like is Robert De Niro. And I heard he was going to be there at this fundraiser that the fund was holding. So I was looking around and I couldn't see the guy, and I'm like, I want to see this guy because I've seen all his movies. It was all on mentoring and whatnot. So I said to my wife, look, I'm going to go step out. I can't see it. Nothing's going here. And I'm not kidding. Literally, as I'm walking out, the guy is coming in. I literally run up and shake his hand. He was so nervous himself. And I thought, this guy's more nervous than I am. And it was interesting because the Fulfillment Fund escort, she's like, who's this guy? And the photographer says, why do you go up and talk to this guy just like that? I said, because I can. He's coming in. This is the guy I came to see. and then we're talking, and it's like this moment of just holding on. The escort's trying to take him through the back because they don't want all the flood. I've got his hand so he can't move, and he's feeling that way, and he's talking to me. And my wife's like, why did you do that? I said, because the fund always said I could. Just walk up to people and talk, and it really goes out to just put yourself out there. And he was very kind, by the way, other than being nervous that I think I shocked him, and it turns out he was Bradley's mentor. So anyway, I'm always for mentors.
I think what I have to say on the topic echoes what has already been said, and that is that it can be so uncomfortable to put yourself out there and ask for help, or ask for for guidance, or to ask those questions. But you really gain a lot and some really great information. I think similar to Raphael, have had a variety of different mentors over the course of my career because I've wanted to do and wanted to look into different things. And so, I've gotten to the point where I can say, hey, I was really interested in this talk that I saw or this training that I went to. I would be so curious and wanting to know more if you'd be willing to meet with me and tell me a little bit more about, how you got to where you are, because I'm interested in that. And from having those conversations, sometimes I've learned that, yes, this is exactly the direction that I want to go. And sometimes when I talk to people, I've been able to be talked out of some ideas as well and realize like, oh, that's not for me. That's not for me at this point in time. It's not a training I'm willing to invest my time and energy and money into. And having mentors that are able to have kind of hard conversations like that, or to really be able to not, just guide you into things, but guide you out of things as well. A lot of those I wouldn't have had if I hadn't just sent, an initial email to say, I want to know more. How did you get to where you are in your career? Because it fascinates me. And I think a lot of the people in this field in particular, right, we're here to help people, whether those are the clients that we work with or patients that we work with, or, people who want to see themselves where we are in the future. So I can't speak for everybody, but I think I speak for a lot, myself and a lot of my colleagues in saying that we also want to help people who want to help people. We know that we need more mental health professionals. We need more clinicians who can work with people. And so I'm always happy to guide people into those things. And so I like to pay that forward from the people that I've asked questions to as well. So while it's uncomfortable, it's led me to some really great places.
Kim, thank you, Rafael, and thank you, Laura, for your insights. I think our discussion also spurred a lot of questions, so I'm going to start dipping into the Q&A and the chat. And here's a question, and anyone can feel free to answer this one. It's regarding going into grad school or going into the world of work already. The question is, would you recommend grad school for a psychology major, or is it possible to get a decent job from a bachelor's alone?
I think it varies per state. I think I could speak for, like I said, I'm living in Minnesota currently, and it is challenging, I think, to find a job that is sustainable at the bachelor's level where I am. A lot of the jobs I think that you could get at a bachelor's level of mental health are ones that have a lot of intense emotions attached to them. For example, I worked at a psychiatric hospital for a while, inpatient, and the psych techs who work, one-on-one with kids in the hospital, help making sure that they're safe, or working in small groups with them. You can do that at a bachelor's level, but it can be very physically demanding work and very emotionally demanding work as well. So I've found that the variety that you can do increases a lot at the master's level. And you know more perhaps about what you're working with and who you're working with that extra level of education.
It sounds like to open more doors and also to equip yourself a little bit better in that field of work. Pursuing a master's degree or graduate program would be ideal. Okay.
Yeah, I mean, I would agree, with Kim. It's and I think you quickly come to that realization when you finish a bachelor's in this field, and it's just I think at minimum you want to get a master's and to pursue of something that you like or even interested in it, because it's not till the master's level that you begin to understand the concepts of how to treat people, how to work with people, or how to even advocate for people. Like right now, when I'm looking to hire people, it's master's level at minimum or doctorate level, because I want them to treat, and we need people to treat. The bachelor's, it's really this. I think someone wrote, if I have a psychology degree, that is a great foundational piece to now move forward and say, what did I like about my psychology degree? I changed many fields of training because I was interested in it, and that just kind of led me to the next phase. But I do think for the job market and stability, and also, now so many programs out there pay for your graduate, like I was fortunate. I worked for the Department of Mental Health. Almost all of my student debt was covered, because I worked where I did. But I think many now community agencies provide that because we need so many people. So I say that because you look at the cost of a master's or a doctorate and you're like, I want this, right? It's like a mortgage in some places. I think at the end of the day, you will benefit very well in the capacity. I don't have a problem finding a job anywhere. And even now online, literally one of my colleagues, she's in Spain treating people in the US under a government contract. Think about living in Spain or living somewhere else, and here you're doing treatment. That's kind of what the things that it opens, and she does a lot of advocacy. So I definitely would encourage at minimum a master's, but clearly will pursue the doctorate if you've got the stamina, move forward. That's what I would say.
Here's another question, and it's sort of in line with, I think, stamina and being able to stay in the career and a little bit maybe of self-care. The question is, I want to become a therapist within the correctional system. I'm just curious as to how was that experience and how do you stay mentally prepared to hear such traumatic experiences and life events? Really powerful question.
I'll give it a jab. So and this goes back to the support and the network. It is very crucial to depend on your supervisors and to depend on your teams. They are going to be helping you grow as therapists and as individuals. And you also see things of your own, what are your limits and how much further you can expand on it. I think a supervisor can be a mentor, it can be a teacher, it can be a guide. And also because during that time, you're also building up your own license, you're building up your own career. And, like everybody's saying, like, is this for me or not? And it's very crucial for that. And also your team members, people that you'll, if you do go into the field of therapy and mental health, depending on your state, you are required to get group supervision, individual supervision. So you'll have like-minded individuals that you will have that support, hopefully on an ongoing basis to process those feelings. So you're not going to be left alone, hopefully not in your employment, where they're going to be able to guide you and support you, because it's not for the faint of heart. Any actually, not even correctional, any position with children, adults, elderly, hospice, whichever field in mental health that you go to, that support within your employment is crucial. And even outside of work, I have a colleague that I have had for like the past 7-8 years that I started in the county with, and I do consults on the side, in the event of, even though I'm licensed, am I doing the right thing here? Am I putting too much of myself, or am I doing something to make sure the person I'm working with is okay? So I think it's still creating those networks within your own employment and outside of the clinical circle to make sure you're doing well.
Thank you. There's a lot of questions, and I apologize to any of our scholars that are here that posted questions that we might not be able to get to. There's just a lot of really, really good questions. Here's another one related to internships. What internships are suggested for anyone who's interested in going into mental health?
I think any, honestly, what the most ridiculous, I think, I tell people, to the most extreme, go for it. There's so many different internships out there that you would have never imagined. Like I know it's probably well known, but when I entered college, I did not know that there was like children's cancer hospice, which one of my good friends told me about, and I was like, whoa, I didn't even know that was something that was out there. Now I would not go in that field, I know my limits, but exposing yourself to different internships. And later there's some sports mental health. There's so many different avenues of the mental health that we can't say, I mean, I personally cannot say choose one, but I think, explore one and expand from there. And I think, Kim and Rafael mentioned it earlier, where the field is so vast that you can jump into different avenues that can either help you navigate different avenues or continue that route.
Yeah, I mean, and I think, apart from internships, I know people think of internships, but to be honest with you, I started at a crisis therapy line. I got a job I've always worked going to school, and that's something I did to try to get me exposed to that process. Being at the school counselor, working with them, and just volunteering in college. When I was in seminary, I worked at the crisis line, so I'd be the guy on the weekends taking all the calls. So you can see where my weekends were, and it's funny because I'd always have this lady call me the same time every week, and I was like, and I'm trying to get her to help because that's what we're connecting. It's a crisis line. And I got exposed to a lot of the clinics in the country. We had clinics all over the country. I mean, I knew the US by just working there, and I looked for that, even though I had a degree in biology and I wasn't pursuing that, I pursued jobs that exposed me to that field, and it was great. It was a great field. I mean, I didn't like that my weekends were taken, but you got to pay for school. So that was one area what I would say. I would say don't focus just on an internship, focus on jobs of things you want to do, volunteering with the kids if you want to work with kids. That's a great idea. I didn't even think of that. And I know earlier you guys asked the thing about how do you care for yourself. Probably since I was in college and even now, I've always had a therapist intermittently. I just cannot tell you how valuable it is to really seek your own therapy, because it really set a good tone about looking for blind spots, I mean, my schools all required it, so it came part of the program. But I'm a big advocate that I think you need to have your own therapy. You need to kind of explore. And that started in college. It was like, yeah, I think if I'm going to go into these fields, how am I going to manage my mental health and avoid burnout and hear all these cases. And you learn a lot of skills from that aspect, but also from a lot of aspects of the peers that have been there doing it for so long. And that's where I think also the mentors help a lot. But definitely seek therapy. You're not always going to find the first one that fits. And I certainly didn't. But I don't think, it gives you kind of a feel of what it is to be on the other side of the process. You're like, yeah, I still remember every therapist. I'm like, now I'm like, oh, he missed that. I told him that and he totally missed me on that. You know what I mean? And so I just think volunteering and getting jobs that expose you to the field is probably the best way. And it's certainly been a blessing.
I would say, just to add on to some of that, is that I think it matters less the specific internship, but so much of therapy and so much of the process of mental health is based on relationships with others. And so seeking internships where you are building relationships with people that maybe are similar to who, the population that you think you want to work with, is maybe a good way to think about it. If you think you want to build a practice where you're working with adults, finding yourself an internship where you might be immersed in adults that you're having to build relationships with, whether that could be at, a shelter-based something, or a hospital where you're working with adults, or likewise, if you want to work with kids, there are kids in schools. So you can always find volunteer opportunities or internship opportunities where you're building relationships with them, and then thinking about how that feels to you. Does it feel right? Does it feel good? Is it something that comes naturally or easily to you? And then those might tell you some things about, who you want to work with or how you best work with people. Because that's kind of what mental health work really is at its core, is relationship building with people. So those are kind of the things that I think about when I think about the experiences I was glad to have.
Thank you. We've got about 4 minutes left, so we're going to start to wrap up. But there is a question in here about advice. And what is some advice you wish you knew when you started in your field? Some advice that you wish you knew, or what is some advice that you would give to somebody who's just starting off in this field?
I would say that there are so many opportunities with a degree in mental health. And I think that the experience of the panelists here would speak to that. We all have very different experiences and very different careers that we are working on. And I think there's been some change and some variety. And so I think that if you think that mental health is something that you want to do, There are so many different ways that you can approach it and so many different populations of people that you can work with, and be open-minded to thinking about how you want to work with people and show up for them. And a lot of that can lead to a career in here. And I think if I had known that, I might have landed on babies faster than I did. But I'm glad for the windy road that I took to get here.
Thank you, Kim.
I think, gosh, it's like the $1,000,000 question, right? What would it, I'm a big person that reflects, so I think through everything that I could have changed, going into this field. But I think the one thing is to not think you have to do it alone. I think when I've trained up so many therapists, they have a solo mentality about going into this field, and that had to change a lot for me. That I needed other people, I needed to seek help, seek the resources, and that's why I tell people now, this field isn't about doing it alone, it's about doing it together with other people. And it seems obvious, but I think when you're going through a master's, you're going through this doctorate, it's like you by yourself, and that just isn't the case. If you want to stay in a good headspace, in a good way, seek the help, seek the resources, and I'm grateful for all those resources, because I really wouldn't be where I'm at right now if it wasn't for all those situations. So don't think you have to do this alone. There's really a ton of people willing to help to get you to the next level, and to say, hey, go this way, go that way. And I'm one of them. Again, if you find me on LinkedIn or through the fund, drop a line.
And yeah, I want to add on to that. It's a very selfless, career, and we get that, but doesn't mean that you have to do that for yourself. The universities have a lot of help that sometimes we don't think that we know that they have it. So, looking into the universities, tutorings, disability testing, mental health, support, they have so many resources for yourselves, and as well as, career sites, they have a lot of that as well. Counselors have been a great asset, and, fulfillment fund, we've been with them for over decades. And so, even to this day, there are so many connections of how can I navigate this, or who can I ask at certain universities or schools. That's been very helpful for me. And I know a lot of my colleagues and friends who went to college as well. So, navigating of the resources that your own school can provide to you, I think is a very, very crucial one to use, especially since a lot of you are paying and utilizing your scholarships. I think it's really good to navigate that, explore it. And it can be daunting. It can be, but that's where a lot of the networking skills, the advocacy, you can utilize that for yourselves. And again, you have a lot of alumni here that are willing to help, guide you in some ways that we can. So I think that's also a big one that can be helpful as well.
Well, thank you so much to our panelists, scholars. Thank you for logging in and listening to our expert panelists here. I want to thank you again, Rafael, Laura, and Kim, for taking the time and speaking to our scholars and sharing your knowledge. We really appreciate that. So this concludes this panel, and we hope everybody has a good night. Thank you.